Campus Thrival Guide, where we cover all of the things that graduate school didn't teach you. Hi, my name is Miranda Barker. I am a licensed clinical social worker, and I have been a therapist here at Ellie for a little over a year. I am joined with my co-host, Dr. Lucas Volini.
Hello.
He has been practicing for a little over 10 years. So varying levels of experience here, but it's good. It's what rounds it all out, right? Today we are talking about ethical dilemmas. And when I was researching and trying to prepare for this podcast, a lot of people told me that when it comes to ethics, I need to be talking to Mark Wilde. So
It's true.
in the room with us is Mark Wilde. Do you want to go ahead and introduce yourself?
Yes. Yeah, my name is Mark Wilde. I'm a marriage and family therapist. I've worked at Ellie a little bit over a year. I've been licensed for maybe 10 or 12. I'm a board-approved supervisor, so my job at Ellie is supervising the community-based staff. So a lot of them are unlicensed or they're still in graduate school. So a big part of my job is helping those people kind of move into being a therapist and making that transition. So
Awesome. Did you yourself work in community-based?
yes, before I was licensed to get my hours, that's what I did, was community-based at the time. Back then we didn't have any computers right, you had to take a horse and buggy between each. So it was a while ago, but I think it's still relevant.
Awesome. No, that's great. And I know that before we were starting this started recording, we were kind of talking about how much the field of ethics has changed even in the last few years.
Exactly.
So I don't know if you want to just kind of jump in.
Yeah, so the reason why I thought it would be cool to talk about this today is because, right, the field of ethics is really changing just since the pandemic and the rise of telehealth and just that kind of component. It's really changed some of the ethical questions that people are asking. Like I remember when I was working, when was the pandemic? March of 2020, something like that. On a Wednesday, they said, okay, we're closing and we're opening back up on Monday and you're seeing all your clients through telehealth. And I said, what's telehealth? You know what I mean? Because we literally, it didn't have any training in it, didn't have any experience in it, didn't have any background. So all of these questions are now kind of coming up now that we're 2 years into it. And telehealth is never going away. I mean, there's lots of advantages to doing therapy through telehealth, but there's a lot of ethical issues that come up too that I want to kind of highlight, especially for the newer therapists kind of coming in that they're maybe not learning about in grad school yet.
Yeah. And I mean, I don't know if I know a single therapist that isn't doing some form of telehealth at this point. Maybe you're not really doing very much telehealth at this point.
Yeah, I'll do telehealth when it makes sense.
Yeah.
I would never, at this point, I wouldn't take on a new client that was exclusively telehealth. Definitely served a purpose, and it's the whole notion of telehealth was still relatively new, but it was established enough to where, people were able to quickly do what we needed to do to make sure folks were still being served. I think before digging into telehealth is, one of the most relevant aspects of ethics right now. But to maybe take a moment to have a conversation around just kind of the broader scope of ethics and the role that it plays in our profession. It's kind of like in graduate school, your ethics class is typically pretty focused on the statutes and moving through the statutes, the various codes of ethics that we have to adhere to, and making sense of them, comprehending them to the point where we could eventually pass an ethics exam, for licensure. And in doing that, we kind of miss kind of the wider notion of the role that ethics plays, not only in our profession, but just kind of in life in general. It's like ethics is a primary branch of philosophy, that is essentially interested in, malfeasance and beneficence, if that's how you pronounce those words.
I don't know those words.
Yeah, I think, malfeasance is harm, causing harm.
Mal, bad.
Yeah. The other one is doing good. You know, what does it mean to do good upon others? What does it mean to impose harm upon others?
Sure.
So just kind of aspects of morality. And so when we kind of teach ethics in grad school, just from the perspective of like, there's this regulatory board and they exist out there and they'll be watching you, you know,
Slap your hand.
Yeah. And like, or end your career.
Yeah.
And these are the rules, you know, that if you know them and if you don't break them, you know, ideally you'll never have to see the regulatory board. So it's and it's not that explicit, but it's also not that far off from that, I would say. Like, it does kind of imply a fear-based attitude toward ethics.
Oh, yeah.
And almost as if regulatory boards are people to be feared, you know, when, I mean, they're mostly our colleagues. The MFT regulatory board in Minnesota, there's an executive director that's always appointed by the governor. That's an attorney, you know, that oversees it, but then it's staffed with primarily working professionals in the field, some community, you know, representation. And I don't know if there's an interdisciplinary component to them, but it's like these are our colleagues. You know, anybody who's licensed in the state is qualified to pursue a role on a regulatory board. If you're interested in doing that, you know, so, but how would we define ethics and like the role that it plays in our profession and the role that it plays in our professional lives as individuals practicing these crafts?
Yeah, the way I try to explain it to the newer people, the newer clinicians kind of coming up and as they're working towards licensure, I look at it as like a decision-making model, an ethical way of coming to an answer, right? There isn't a answer out there that's right in every situation, but it's more a model, a way of thinking, a process that you have to go through to reach a decision. So that's how I kind of think about it. And I like what you said about how it's kind of integrated into who we are as people, right? Or just how we move through the world, both professionally and personally. It's just an ethical kind of mindset, right? And people have to, especially newer people in the profession, really have to stay away from this idea of like there's a right answer out there and I just have to find the right answer, because then they're not relying on their own kind of skills and intuition and things like that.
Yeah, and that's another, you know, when you mentioned that, that's another deficit to teaching ethics purely from a platform of like, these are the statutes, these are the regulations, because they're not black and white.
Right.
Like, they're not you can't do this, you can't do that. So it's like you need to understand them at a very conceptual level. And in like the tricky ethical dilemmas, it's hardly ever just one statute that's relevant. You know, so you also have to be able to comprehend how the statutes communicate to each other, and seeing them as like one collective whole. You know, and I would say the collective whole of ethics, well, maybe one way to look at it would be, you know, I like taking things to their extremes. So like imagine our profession absent of ethics and regulatory boards, which when therapy, especially like family therapy, when it first started, like in the 50s and 60s, there were no ethics.
Right.
There were no regulatory boards. There wasn't even licensure. And so that's where we saw things. Huh?
I was going to say, that's where we saw therapists sleeping with their clients
yeah,
all the
right.
time.
That's like that allowed for the emergence of hot tub therapy. You know, which one of my professors told me about his engagement in. You know,
I don't know what this means. Hot tub therapy?
Yeah, it's just like doing therapy, but in a hot tub.
Right.
I'm sorry, that sounds great.
I mean, you know,
there might be some boundary issues there.
I would not sign up for that.
I'm joking.
Yeah,
that sounds horrible.
I would not list it on my Psychology Today profile. Willing to meet in a hot tub.
Oh my gosh.
You know, and so they're super necessary, and the easiest way to, you know, kind of make that argument is to, again, just imagine what the profession would look like without them. So right from the get-go, it's like, it's good we have ethics.
Right.
It's good that these things exist.
Mm-hmm.
You know, but like the way that I see ethics relative to the professional work which I think, is parallel to how I view ethics in my personal life. Like when we're talking about ethical decision-making models, it's like, look how much thought we put into not causing harm with our clients when we're in an ethical dilemma. And it's like we can also do that in our personal lives. It's like we could be, maybe not like manualize it, but it's like we're constantly caught up in ethical dilemmas, whether we realize it or not. So seeing how it exists everywhere can help move toward integration. But another exercise I like to have students do with the Code of Ethics is to read through the Code of Ethics and identify one that you don't agree with, that you think shouldn't be on there. And like the answer to that question is ultimately like none. Like they should all, like they all more or less make sense. Like there's not really something on there that you could look at and say, I don't think that should be the case, and then justify it with an answer other than like outside of, but like I would personally prefer for this to not be a rule. Right. Because I think it would be great to just, like if my clients wanted to give me a gift, I would like to be able to accept it.
Yep.
So I work with some wealthy people. And they're all about bonuses, but it's like this stupid statute doesn't allow me to get my year-end bonus from my client. And so it's like they all make sense. We need them there, so like I'm appreciative of ethics because it does define the parameters of where things can go and where things shouldn't go, where things absolutely can't go. And, when you understand them as a whole and how they communicate to each other, it's like I would say it's an asset in therapy because like once it all really integrated for me through a lens of appreciation, it's like I really don't think about ethics much at all when I'm working with clients. It's like because it's so integrated, because I get it and I know that it's there, it like frees me to be more disinhibited in an experiential process because I'm not caught up in being fearful of doing something that could get me sued.
Right. And I think that's a common growth area for newer people into the field. They're hesitant, they're kind of second guessing, they're holding back, they're not really engaging in a therapeutic way as much as they can once they, like you said, integrate that, because they're out worried, I'm going to get in trouble or something bad is going to happen, right? But if they kind of integrate it into their life, their day-to-day life, that makes them better therapists.
Yeah, and like if you're of that mindset of you get out of grad school and you're like being extra careful, it's like you do the total opposite. It's like this is the safest time for you to make mistakes. This is the safest time for you to be daring because in most states, the regulatory board doesn't even know you're practicing. Right. It's like everything falls under the supervisor. It's like whoever and that's why supervision it's a liability, it's a risk, and why a lot of people don't want to do it is because if I take on an intern, anything they do with their clients in one way or another, I'm responsible for it. So it's like if they get reported to the licensing board, their supervisor goes with them. So it's like don't be reckless. But when I finally got licensed, like in Minnesota, it's you take an oral exam like in person when I was doing it. So you go to this government building, sit in front of the powers that be. In my mind, I always imagine it'd be like a table of like judges like on an elevated stage and just like an old school desk and a cup of water and me.
And a bright light in your eyes.
Yeah. Instead, I was greeted by a lovely man wearing a bright Hawaiian t-shirt, And I was like, oh, you're Herb Grant. I've heard a lot about you and your Hawaiian t-shirt. I knew it was him because everyone would just say he always wears Hawaiian shirts. And like it was casual, it's still nerve-wracking, but they print your license right then and there if you pass. And so I passed, got my license, walked outside, and like it was definitely a relief, and it felt really good to get there. But after that excitement settled, my very first thought was like, oh my God, it's like I am fully responsible for myself now. Because I had a lot of fun in those post-grad years. I was fully aware of the protections I had, and I didn't exploit them, but that's when I really refined my use of paradoxical interventions, which caused my supervisors an incredible amount of anxiety. Which, falls back to ethics too, where it's like ethics are so gray that we often, when we have a shallow understanding of ethics or again a fear-based one, it's like we take less risks or we over-attribute risk to things that aren't necessarily risky and could be helpful for the client. Y'all ever get caught up in that one?
Yeah, I like what you were saying about trying not to look at the licensing or the regulatory oversight as kind of like the enemy,
Yeah.
right? Because they're there to help you learn and to grow. And if there ever is some kind of boundary crossing, my experience has been most of the time they'll come back and say, well, get more training on this or get more supervision on this. You know what I mean? Like they're there to kind of help you learn and grow, and they're there to kind of ensure that the profession is healthy and things like that. But it's not a punitive kind of thing for the most part.
Yeah, like I would encourage everybody to do this. Go to your state licensing board or regulatory board's website, and they're required by law to publish the results of any investigation they had to do on a licensed professional.
Oh, really?
And so, like, I went through a phase where, like, this was, like, the closest thing I ever came to, like, getting wrapped up in, like, trashy reality TV. And, like, it wasn't trash, but I felt like I was having that was serving the purpose of why other people watch it on TV. It's like I think I get it now, because it is like gossipy, but it's all true. It's all real life. And the people who lose their license, were like they get reported, they investigate, they find that the report had merit, and their license is immediately revoked. Are people who like were just straight up having sex with their clients or students or supervisees. It's when they knew that what they were doing was unethical,
Right.
but they were doing it anyway. Those are the people that they'll hit hard, and that's a good thing. It's like we don't want those people in our profession. And it happens far more frequently than you would realize. You know, to what Mark was saying, if you're acting with good intention, you know, and it's clear that, you know, whatever it was that happened or played out, especially if you're a newer therapist, like some things just slip, you know. Like they work with you in those situations.
Right.
You know, like it's not going to be you're done. It's all over. It's going to, like, if you're licensed, which you will be if you're dealing with the regulatory board, a lot of times it is like 3 months of supervision and ethics course, you know, things like that. And then, you know, you just continue to practice once you meet their criteria. So that's important to keep in mind too.
That it's not just like a huge punishment, but it's also like it makes sense.
It makes sense. And the regulatory board's purpose fundamentally is to protect the public.
Yeah.
You know, that's what they're there for. And it's like clients of therapy are vulnerable. Patients of any healthcare provider are inherently vulnerable.
Well, there's that power differential.
Yeah.
Absolutely.
And just the power differential within a context that requires an incredible amount of vulnerability. And so it's necessary to make sure that it's regulated in a way that does in fact do everything it can to protect the public, because if we weren't to protect the public would lose all faith and trust in us as an institution, and we wouldn't even have a profession. So ethics are good, you know, it's like, and they're gray, they can be ambiguous, except like the don't have sex with your clients. That's pretty black and white. People love violating it. So like what comes up? I don't know, like we can talk about like ethical dilemmas. We can go into teletherapy because it has been a super interesting kind of happening.
Well, I did
in the
some
profession.
research, and I came up with a list of ethical concerns that were most mentioned in like the research that's out there and articles that are being written, some of the most commonly kind of explored ethical concerns. And the first one by far is confidentiality. And then not even a close second is like privacy issues and competency issues, crisis intervention, risk assessment, boundary issues. Those kind of things are the main things that people are talking about when they're talking about ethics. And I think what they mean by confidentiality is like disclosing that the person is even in therapy or talking to their, you know, like I had a client, a supervisee once who the client was an adult, but their mother called the clinician, and the clinician just had a full-on conversation with their mother. Like, I don't know, it's their mom. I don't know. She's like, so she had this full-on conversation.
Can't do that.
Can't do that. So that's what I think they mean by confidentiality. Those kind of things are where ethical, you kind of have to work through that ethical decision-making process. And kind of like you were saying before, the reason that became an ethical issue or a mistake was because they didn't even recognize that it was an ethical issue. That's the first step. You know what I mean? Like, hey, before I take this phone call, I've got to go through a process of making a decision.
And that is a black, like I would say confidentiality and privacy rules, those are black and white. Like,
Right.
It's pretty late. There's not much of anything that's ambiguous there if you're fully aware of like the statutes.
Right.
You know, like in Minnesota, adolescents do have certain rights to privacy and confidentiality that their parents don't have access to just because they're the parent. Know that.
Yeah.
You know, it's like that, and that's like that's in the Minnesota rules that transcend like all the different disciplines, you know? And so like know the difference between like state laws and like general practice guidelines and your specific regulatory board's code of ethics, because those are two different things as well.
Well, and as someone who sees a lot of kids and adolescents, I think that's a conversation I'm having in the very first appointment when I have the parent or guardian in front of me and I can say, look, I know that your mom, I know that your dad, I know that you're signing this paperwork, but I need your child who's sitting next to you to hear me say to you that what is said in here is not just automatically told to you.
Right.
Like, I mean, I think that for especially teenagers, it matters so much to them that their parents know that. And so it does get kind of sticky, though, in this state where, like, technically they can be 16 when they're, like, consenting to stuff. That can...
Yeah, so
like,
you don't even have to be 18 to consent. So, like, you can consent for your own therapy as a minor if you meet certain criteria and your parents, you know, don't need to be any part of it or even know that you're going, you know. But in those situations... It's like if they're trying to use their health insurance.
Exactly.
It's like your parents are going to know that their policy is being used.
Yeah.
But yeah, like in Minnesota, it's if the provider discerns that they have the cognitive capacity to fully comprehend and understand the confidentiality agreement, you know, and their rights as a client, they can consent for their own treatment. If they're pregnant, you know, or if it's anything related to a sexual concern, like STDs or abortion, parents don't need to consent.
Access
and also,
to birth
also
control,
if they're
I
a parent.
think. Access to birth control is one that
Yeah.
you don't need a parent consent.
And if you're a parent yourself, it's like if you have a kid,
Oh, right.
you can consent for your own health care. You know, and so it's like, it's like the easy answer to that for a lot of folks might be 18. You know, but it's like there's more complexity there. And so like in that situation you were talking about, Mark, I would see that coming up often with adolescents. Like when I would work with teens a lot, their parents were always calling, wanting to know what was going on, what was being said, what was being shared. And if you're under the mindset that because they're a minor, their parents have complete access to all of that, it's like you're wrong.
Right.
And you're probably causing some degree of harm because your client's telling you things. Like it's super important for adolescents to be able to say things about their parents, knowing that their parents will never find out about it. It's like good luck doing effective therapy with an adolescent without that being an inherent part of it.
Yeah.
So, yeah, it's like understand the complexity. Understand like even like for AAMFT has a code of ethics. That code of ethics can only be enforced if you're a member. You know, so it's like their code of ethics doesn't govern how I practice, not in any capacity. So it's like it's your licensing board, their code of ethics, but also your state's just general laws governing the delivery of healthcare. There will be a section specific to behavioral healthcare and therapy. It's like, so like familiarize yourself with all of that. And then with ethics or with like privacy and confidentiality, HIPAA is federal law. So, I mean, there can be some variance in state to state, but HIPAA is enacted in every single state in the country. And so definitely familiarize yourself with HIPAA. And that stuff's all black and white too.
Yeah.
Right.
When you say AAMFT, is that like my NASW?
Yeah, the American Association of Marriage and Family Therapy.
Okay, so got it. So yes, it is. NASW for social workers. So a big part of what I wanted to talk about in this episode is, you know, like common ethical dilemmas that you're seeing. You both are supervisors, and so I'm interested to hear like what are some things that you're hearing and like how are people navigating ethics in practice right now?
Yeah, well, one of the areas, like I said, the reason I thought it would be interesting to focus on telehealth is because one of the areas that's coming up a lot with the people that I supervise is like releases of information or policies and procedures that, getting signed and going over that because it's telehealth now and people aren't always in person. Like I have supervisees who have never been in the same room with their client.
Sure.
You know what I mean? So like, hey, I need this release of information to talk to your case manager, right? But I got to put it in some kind of electronic form and I have to send it to you and you have to fill it out and I have to send it back. And a lot of times the supervisees are like, oh my God, this is a lot of work and why do I need to do this? And they just told me it was okay, and all those kind of complexities. Telehealth kind of puts another barrier in between you and the client. And so those are a lot of the ethical things that are coming up, right? Like we need and through the pandemic, they relaxed a lot of those things. Like you didn't need a physical signature on a lot of those documents during that pandemic time. But I don't know if they're going to go back to that or what, but just some of those kind of confidentiality and privacy things, those are the issues that are coming up a lot.
What about you, Lucas? What are some things that come to mind when we talk about ethical dilemmas?
I've primarily supervised graduate students, like an internship. I've done some post-grad dyadic supervision. I'll probably get a group rolling. I really like doing group supervision. Like with students, I feel like it's kind of different because they're just terrified. Everything's scary.
Yeah.
And like appropriately and rightfully, they don't want to cause harm. I think, your first clients when you're an intern, I mean, that can be a heavy weight, because part of understanding ethics is, understanding the extremes of how much harm we can cause, and how much we can fall short, unknowingly or sometimes out of negligence. And, so there's just a lot of what we cover at that level. I think boundaries is a big one. I think when you're a newer therapist, a lot of like the ethical stuff you get into is probably more so a product of just a lack of confidence and competence, that what they're doing is just fine. It's just hard for them to see that or understand it. I would say in general, at large, like the teletherapy thing has been a very interesting ethical dilemma that's been ongoing, and it's like we had to do it. We made the right call in doing it. But we did it so forcefully and so fast that such a significant percentage of therapists have just stuck with it. And so it's like, it's not like we can move backwards now and like have people get certified or like demonstrate formal competency in this delivery. And it's like research is still in the process of figuring out its efficacy. A lot of the ethical dilemmas don't have like good answers. Like when you're doing teletherapy with someone who lives in a remote location and they're homicidal or suicidal, well, one, it's like you don't even know where they are.
Right.
They could be anywhere when you talk to them. People that do like phone therapy or like text therapy like that's text therapy's, I think it's insane.
Yeah, that's crazy.
Like it is, I think it is a disgrace to the craft and art of this profession.
Right.
I think it perpetuates a problem that drives people to therapy, which is like, texting is a horrible way to communicate. And it's like, who do you even know who, like I could have my buddy John.
Right.
He might be unemployed. I don't know. I haven't called him in a while. But I'll be like, hey man, it's like, you give okay advice. I'm going to make you this account with my license. It's like, you just text people all day and I'll take 40%.
Well, and like so before I came to Ellie, in the last job I was at, maybe it was 2 jobs ago, I went through like an EAP program and they set me up with a virtual therapist through like one of the big companies. And I met with her a couple of times virtually. And then at the last appointment that I had with her, she had sent me a message and was like, hey, I'm not in like a super private place right now. And so is it okay if we do text therapy instead? And looking back on this, I'm like, oh my gosh, what? That's like the weirdest thing that even existed. And that was her response. But like, she could have been sitting at a coffee shop texting me. I have no idea. But I'm like I'm not even joking. I was sitting on my bed crying, texting this therapist.
No.
I know. And I think of like little Miranda and I'm like, oh, that was sad. I was not getting the support I needed in that moment.
No.
And like, you can't text very fast. I mean, I don't know. It was.
Or you're missing a lot of nuances and body language and
absolutely.
That's garbage.
It was garbage.
We'll dig more into that when we do our garbage therapy episode.
It's traumatic.
Garbage going on out there. Gosh, that's that's stinky garbage.
I know. I can't believe that. I can't even believe that happened. And honestly, I feel like I blocked that out until you said that. And I was like, oh shoot, I was part of that at one point, or like received services from that at one point. But it was so much. Exactly what you were saying, Mark. It's like you miss out on so much when you're having text therapy. It's unbelievable that's even a thing. But
and even like with Mark, when you were saying like there are a lot of benefits to teletherapy, that's true. But I would say the list of benefits for the therapist is significantly longer than the list of benefits to clients.
Yes,
You know?
I never
absolutely.
thought about it that way.
And like when teletherapy was starting to happen before the pandemic, and so people were starting to talk about it. There's this one guy who I met at a conference, who I would just see his stuff. He was a big social media poster. And so like he rolled out a campaign on 5 reasons why you should move your practice to a telehealth platform. And all 5 of the reasons were directly speaking to the benefits it causes for the professional and the provider.
Oh yeah. Oh,
Not client care.
No, it's like no overhead. It's like have more flexible hours. Be at like no child care.
Right.
Or pet care. Right? It's like, who's watching your children then?
Let me tell you, my daughter was sick this week, and so I didn't see clients, but I did have this one meeting with other colleagues, and like it didn't go well. I mean, the girlfriend was watching Miss Rachel on YouTube. If you're also a toddler parent, you'll know what I'm talking about. She was watching Miss Rachel, and she comes toddling into the room, and she's just like, rah, 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 rah. And obviously everyone that was on the meeting was like, oh, baby girl, you're so sweet. And I'm just like, oh my word, I would never, ever, ever be able to work from home with no childcare. Like, it's just impossible.
Right.
It's impossible.
It's impossible.
It's bad. It's like you're simultaneously being a bad parent and a bad professional.
Yeah.
Absolutely. Yes.
I don't think that's, necessarily the number. I would say a minority of therapists would do that do it for that reason. But like benefits for the client, like for underserved areas, absolutely.
Right.
Sure.
For people that it's a challenge to travel or commute even to a clinic to a mile away. Absolutely. It's like there's a ton of ways that it's increased access to therapy, which isn't ever anything to complain about, unless access comes at the expense of quality.
Right.
And I mean, honestly, we just don't know yet. It's like we don't have nearly enough data to make any formal conclusions at this point. And therapy in general has always been difficult to measure, efficacy. Humans are just so unpredictable, and it's like no one therapist will practice the same model or intervention the same way. Right. And so like almost all the efficacy research is spoiled by the individual qualities of the therapist. But it's like I can say for certainty, and I say this to clients. I was saying this because I took on 2 clients during the pandemic where it just had to be remote. And I told them from the get-go that like with this teletherapy stuff, like I'm happy to do it, but just know you're going to get no more than 80% of my best compared to like in-person, in-office therapy.
You said that? That's
Yeah.
so interesting. I mean, I am not disagreeing with that, but damn, you bold.
Well, yeah, and it's like, one, I think it's ethical to tell them that. And 2, I don't want to perpetuate the illusion that it's an equivalency, that it's an equivalent method.
Well,
'cause
and
it's
that's
not.
part of informed consent too, is letting them know all the different options and the benefits and the drawbacks to each one of the different options, right? Like, okay, yeah, we can do telehealth and it may be more convenient, but it's going to be more difficult for me to build rapport with you and to connect with you and kind of understand what you're thinking and feeling if we're doing it through telehealth, right? And I think a lot of therapists don't have that conversation.
Yeah.
The client's just like, yeah, it's super convenient. I'm sitting on my couch and I'm having a therapy session.
Right.
But part of our job is to give them that informed consent and say, look, this isn't always the best thing. That's an ethical decision that you have to make, right? That you have to give the client all the options and explain the positives and the negatives of each. And I think, right, some of the newer clinicians in the field, a lot of them did their graduate programs through telehealth, or you know what I mean, and they talk to their grandma through telehealth, and they FaceTime their partner or whatever, and it's just like, okay, this is just what we're doing. But I don't know if that's...
Yeah, you bring up some good points.
Yeah.
Absolutely.
I would love to know the number of therapists that multitask during teletherapy
Oh my
sessions.
gosh.
Because I've heard that a lot from consumers, like either clients I work with who see other people or like friends I know who are in therapy. Like it has not been uncommon for people to say like, yeah, like I know my therapist is like texting or
Right.
like
Yeah.
writing case notes or like has another screen
Right.
that they'll look at.
Well, you and I have talked about this, Lucas, because the same, therapy company that I was texting my therapist with was, I stopped seeing her because it was pretty clear that she was multitasking, and I just was like, all right, this is the end. But like me, I mean, I think I get what's the word I'm looking for? I get distracted really easily. Why was that so hard? I get distracted really easily. And so I have to have a fidget in front of me if I'm ever doing telehealth.
Yeah, fidgets.
Like I
Fine.
have kinetic sand sitting on my desk 80% of the time, so I can play with that while I'm talking to someone. Or if I have other fidgets, I have a nice little fidget ring that I play with. I also, like, these are things that I know I have to do in order to be present with my clients, because I think it's actually really common to just kind of let your mind wander, or like it's like second nature to just pick up your phone, and then you're like, oh,
Yeah, you need to occupy all that like muscle memory.
Yeah, well, I have to just like
stuff.
be doing something with my hands.
Yeah.
That's 100% it. And
Yeah, because there's never another situation in which I would ever just stare at a computer screen for 60 minutes and not do anything else.
Right.
But stare at that. Like my brain doesn't know how to do that.
Yeah.
And so like that's the right side of ethics, because if somebody was like, and this would never happen, because you were staying attuned to your clients. That's why you were doing the fidget, and when your client likes you, you're significantly less likely to get sued by them. But if they were to report you and be like, Miranda Barker was playing with a fidget during our teletherapy session, the board would have to investigate. You would show up to that investigation and explain to them why you were doing it. And it would be very clear that you were doing it with the client in mind and the client's best interest in mind. And if there was nothing reported other than the fact that they thought it was weird, it's like that's a open and closed investigation.
Yeah.
People who are multitasking, it's like they couldn't possibly generate an argument that would suggest they were doing that on behalf of the client.
Oh, right.
And
no.
unethical.
Well, and I think this is different than concurrent charting, which we'll talk about in a different session.
Yeah, we'll dig into that one. That's an
Yeah.
interesting concept.
Yeah, but very different, because that is when I have done concurrent charting, it's I'm talking to the client about what I'm writing and doing.
Yeah,
it with
that can
them.
be done
But,
well.
Yeah, but it is kind of weird to think about how similar those two can be. But
I had a colleague at my last clinic who I shared a wall with, and so like I can't hear exactly what they're saying, but it's obvious they're in a teletherapy session, and they're sending me Teams chats.
Oh, that's crazy.
And so like I just responded like, don't Teams chat people while you're in session.
Right.
I'm glad you said that.
Oh yeah, I have unethical garbage therapy. It's like blasphemy to me. I experience it as blasphemy because it does shit on our profession.
Yeah.
Right.
It makes our profession look bad, and our profession is super vulnerable right now in the public eye. You know, it's like we're still combating a lot of stigma. We still have a lot of demographics that have a degree of mistrust or already a sense of closedness, that all they need is like one story of one person getting garbage therapy to then say, yeah, see, I'm never doing that.
Yeah, absolutely.
It is a joke. It is a waste of time. And so like, that's why like I do like this therapist you had, I'm going to be thinking about her for weeks.
Yeah. I think that kind of as we're starting to wrap up this episode, I want to make sure that we're talking about like what were some important things that you guys have learned about ethics? What are some things that you both have been practicing for a long time. What are some things that you'd want to be sharing with the audience?
Yeah, well, one of the important points that I wanted to make is just the importance of just kind of consulting and talking about your cases and having good supervision and talking through all those processes and decisions that do come up. One of my biggest pet peeves is like licensed professionals who are maybe self-employed or, you know, who are kind of on their own, but they're never talking about their cases, or they're never saying, hey, what do you think about this, with another licensed professional.
They're siloed.
Those are the people where those ethical things happen, right? Because most of the time, these ethical things that you were talking about, that, you know, the complaints that come in, the board actions or whatever, most of the time, if the therapist would have said to somebody else, hey, do you think that's a good idea? Like the other person would have said, hell no, that's ridiculous. Don't do that. You know what I mean? But they didn't ask anybody, or they didn't consult, or they didn't, you know, have a discussion about it. So that would be my biggest point, is you got to continue to talk to people about this. You can't make ethical decisions on your own because you have blinders on. Like, hey, I really, really want to loan this client $500 because they're really down on their luck, and, you know, I really want to do that. So you can't make that decision by yourself because you already have an opinion about what you want to do. You know what I mean? So that's just my point, is you got to keep talking about it. You got to keep consulting. You just got to, ethical decision is a process that you got to talk through.
It's a craft.
Yeah.
You know, and there's artistry to it, you know, of how you get to your final conclusion when you do it well. So yeah, it's like ethics are our friend. You know, it's like there are parameters to inform how we can go about doing the practice we've signed up to do without causing harm. You know, and so again, non-malfeasance is intentionally not causing harm. Beneficence is intentionally doing good, and we should strive for both. You know, because you don't necessarily do one without, or when you do one, that doesn't automatically take care of the other.
Right.
And so, you know, and I think a helpful way to start expanding the complexity of how you understand ethics is to start examining how you ethically show up in your personal life. It's like we all have a code of ethics that governs our conduct. Some of us are aware of it, and some of us have taken a lot of ownership and intentionality to draft, you know, and kind of script what our life, you know, kind of code of ethics are. A lot of people have just internalized them, inherited them, you know, from early experiences or other people. And so it's like it's still governing them, but maybe not necessarily in a way that benefits them and others. And so, like, examine ethics and the role that it plays in your personal life. And then as you kind of bring that back to your professional practice, if you've never gone to your state licensing board's regular meetings, most boards meet monthly. It's like, go check one out. They're open to the public. And that'll really help to, one, not only demystify like what the regulatory board is, because you'll just see people not all that different than you, just more experienced, who were at a point in their career where they could serve, you know, in that capacity. But all their conversations are about making sure we're properly protecting the public, but majority of them know that the best way to protect the public will be to make sure that we're still optimizing like the experience of the profession. You know, it's like they want providers to be able to practice in ways that are going to most benefit them as professionals, because the more benefit they receive as professionals, the more that's going to benefit the public. And like anybody, it's like the statutes that govern your license, those work like any other legislative process. If you think one should be changed, it's like draft something up, propose it at a meeting, and then they put it up for a hearing, like any other issue. So any member of the public, but particularly people who are licensed, you have say and sway over how your discipline is governed in the state that you practice out of. You know, it just requires initiative and involvement and knowing how to navigate that. But yeah, I would strive toward getting to a point where like ethics have become so integrated into how you practice that you're not really ever intentionally thinking about ethics outside of like limits of confidentiality stuff. Like, you know, it's like when you get that spider sense, you know, that this is
Right.
inkling toward mandated report, you know, a duty to warn. It's like it's like shift into that ethics mode, like very intentionally, and know how to navigate that, you know. But outside of that, it's ethics are kind of a pathway for you to learn how to fully trust yourself as a provider, you know. And like that's what ethics allowed me to do, was to trust myself as a provider, because so long as I stay
you know
within
you're
these
being
parameters,
ethical. You know, then
I know how to
within
be
those
ethical.
guidelines, then I feel comfortable
Yeah.
being more creative.
Yeah, and so I do think when they're done right, it's liberating. It's not constraining.
And how would you tell people to kind of explore their own ethics, like you were saying? Like a lot of it
read
is
some philosophy. Everybody should read philosophy. Like read into how philosophers talk about ethics at the level of just like basic human morality. And when I say morality, majority of philosophers do that from a non-theistic perspective. Like it's truly just like what we've come to understand about the nature of humanity, and how we can learn from those lessons to try to discern like right from wrong, what's good, what's not good, and how you can ultimately act more ethically in your life if that's your goal. And maybe I'll just say this point too. Don't ever tell yourself that like when you dig into those reports on your board, you know, next Friday night when you're feeling like you're
Ready for some trashy TV.
Yeah, ready for some trashy TV. Don't tell yourself that you would never do that. You know, it's like as you read this stuff, tell yourself that you are just as capable of doing that as that person was.
interesting.
You know, it's like, and this is just like typical Jungian shadow stuff. But that's one of the most neglected teachings, I think, in our discipline. It's like people that, and this goes back to, if you want to act ethical, it's like wanting to be ethical can only happen if you're fully aware of your capacity to be incredibly unethical. And then you identify the things that you need to be intentional about doing to make sure that never comes out of you. And I think that's enough.
Right, because I mean, I think by the time you make that decision that actually gets you in front of the licensing board or something, you've made multiple decisions leading up to that already.
Absolutely.
Right? So like you said, I would never do that big thing, but I'm also already making choices that are leading me towards that big thing, right?
Yeah.
So,
Like the therapists that had sex with their client, the many of them, it's like they didn't show up day one at grad school and be like, all right, I'm gonna do all this work just so I can have sex with a client.
right.
So
Yeah. Well, so this has been a great discussion on ethics, and
there'll be a part 2.
I feel like there should. I love learning from you guys, and I feel like we've only scratched the surface. But I appreciate you coming on here, Mark. And
Thank
Your
you.
legend precedes you.
Yeah.
friend.
Absolutely. Awesome.
Thank you.
Well, good luck looking through your licensing board stuff. Enjoy reading through those reports.
The scandals.
Just kidding. Exactly. And I look forward to seeing you in 2 weeks for our next episode.